Good evening, brothers. Welcome to the Eastern Province Health and Wellness Committee first program about mental health. This is May, which is Mental Health Month, and we want to present a conversation with Black men to Black men. I'd like to recognize the Health and Wellness Committee. I chair Dr. Stephen Hamlet and our other committee member, Dr. Urban Hunter, for supporting this program. Brothers, at the end of this program, we will be asking for a survey. The survey will be posted in the chat area. It will also be posted on the Eastern Province website. So please complete the survey at the end of this program. I'd like to start with our panelists. Again, my name is Brother Dr. Christopher Bishop. I will be your moderator. Our three panelists today is one, Dr. Samuel Gordon, who's Assistant Director of Psychology at the MedStar National Rehabilitation Network, and has a small private practice and been committed to providing psychotherapy services to the inner city residents of Washington, D.C. since 1983. He's born in Panama and raised in South Bronx and Harlem communities of New York City in the 1960s. Dr. Gordon's interest in the mental health of urban residents began during the heroin epidemic, related radical destruction of his home neighborhoods in the late 60s and early 70s. He served 4 years in the U.S. Navy as a hospital corpsman, and after receiving his bachelor's degree at the City College of New York, he pursued graduate training in clinical and community psychology at the University of Maryland to acquire skills in both prevention and treatment of mental and emotional disorders, with a particular emphasis on urban dwellers. Since earning his doctorate in 1987, he joined MedStar National Rehab Hospital in 1989. Dr. Gordon has developed specialty in working with young African-American males struggling to adapt to living in the inner city neighborhoods of the Washington, D.C., following a gunshot wound-related spinal cord and brain injuries that had left them wheelchair-bound. He also had taken on the challenge of helping patients with substance abuse disorders, complicating their recovery from brain injury, stroke, spinal cord injury, and other disabling conditions. Pertaining to those facilities in the Urban Reentry Group and Relapse Prevention Group, each aim at bolstering the resilience and skills necessary to re-engage in various aspects of society without resuming the substance abuse and violence-prone behaviors that accumulate in their physical disability. Welcome, Dr. Gordon. We also have next Dr. Emil Logan, has owned and operated a private counseling practice, Each One Reach One Psychological Service since 2007. He's also a psychotherapist for Kaiser Permanente and an adjunct professor at Marymount University within the counseling department. Dr. Logan is licensed as a professional counselor in the state of Virginia, Maryland, and District of Columbia. He's also trained at EMDR. Dr. Logan has over 25 years of treating an array of mental health disorders within a variety of mental health environments. Dr. Logan received his undergraduate degree in psychology from George Mason University, a master's degree in community counseling from Wilmington University, and his doctorate degree in clinical psychology from the Chicago School of Professional Psychology in Washington, D.C. Our third illustrious guest is Chester Marshall, who's the founder and CEO of the Institute for African Man Development, Inc. in Washington, D.C. He's also an adjunct professor of social work at Howard University in Washington, D.C. He has more than 33 years of experience in providing social services program development and management in various settings, including child welfare, therapeutic communities, and private practice. He's helped develop successful programs targeting African American men and boys in the DC and Chicago areas, including mental health, rites of passage, therapeutic-based, and training curriculums. In 2010, Mr. Marshall was appointed by DC Congresswoman Eleanor Holmes Norton to serve as commissioner of the Congressional Commission on Black Men and Boys. He also serves on Washington, D.C. Mayor Muriel Bowser Commission of Men, Boys, and Father. He received his bachelor's degree from psychology from Grace College and his master's social work from Howard University. He is a certified in clinical hypnosis and neurolinguistic programming and is certified into psychotherapist. He also holds certificates of rational and motor behavior therapy from the Albert Ellis School in New York and is a graduate of the National Association of Black Social Workers Academy of African Centered Social Work. He is also a well-published author. Black Men Heal, Volume 1, a resource made for the healing uplifting of African American men and boys, and Black Men Heal, Volume 2, the blueprint for healing disconnected African American men and boys. He's also the author of Lies by the Number, the negative imaging of African American men and boys through the use and misuse of statistics, and has written countless working papers, articles, and curriculums on the subject of development of African American men and boys. So I'd like to thank all the panelists here being with us today. And we're going to get started with the first question. Could the panel please tell me, what is depression and how does it present itself? Who would like to take that question?
I can at least start and certainly ask others to sort of chime in. I think depression, maybe just by the word depression, sort of talk about being depressed, sort of like a push down, and that sort of manifests itself in both sort of low mood, like a depressed mood, whether that would be considered sadness, and oftentimes it comes along with other symptoms. But in Black men, maybe we may not necessarily call it sadness. We may call it the blues, maybe. But oftentimes we call it anger. It will kind of manifest itself with anger because one is sort of dissatisfied with life, but it still winds up being a unhappy mood, whether it be anger, sadness, blues. It still is an unhappy mood. It also has a depression in terms of one's physical energy. Oftentimes, people who have depression don't have the energy to get up and do the things that and or the motivation, and they kind of go together to be able to go out and do the things they need to do to sort of be fruitful in life and have a productive life. And again, the depression will also affect the mind in terms of the ability, one's ability to sort of use their thinking skills and concentration and problem solve and those sort of factors. So I would probably say it's kind of, if you will, depression in terms of your mood. It depresses your mood, depresses your physical energy and motivation. It depresses your thinking abilities.
Okay, thank you. Any other panel member like to add to that?
I would like to just piggyback on what Brother Dr. Gordon said, in that in addition to all of that, it's also a chemical imbalance. And the chemical imbalance causes a lot of those things to occur. So just want to put that out there. Someone might ask, well, how does one get to have a depressed mood? And I think it's having a lot to do with the chemical imbalance.
I would just add that generally the causation is found in the family, some kind of family history, in the personality of the person themselves, or in some other related illness.
I would probably tie that all together. It is what we call a biopsychosocial model, where it could be biological, as was pointed out in terms of the genetic and maybe even biological, biochemical pieces. And obviously there could be some familial factors and stress factors that can add to that. I just wanted to point that out because maybe not everyone may have a biological factor, but it could be caused by some extraneous external factor that can then trigger sort of that biological cascade or that biochemical cascade.
And I'm glad you said that, because that's something we definitely touch on later, because as Black men, we are triggered by some external things in our environment that might trigger that depression. As we're talking about that, we throw that word depression out a lot, and everyone kind of just group it all together. Can you tell us what are some myths about depression that as Black men we should be aware of?
I'll start off with that one because I think that's really, really critically important, because misinformation really does drive us to miss opportunities to get treatment and to get better. One of the biggest myths that I have encountered in my practice is that in men, number one, that depression is a woman's thing, that only women get depressed. Which we know, in fact, is not true. Another myth is that depression, clinical depression, is the same thing as sadness. And we definitely want people to understand that when one is clinically depressed, that looks and feels very different than somebody who is, say, have a major depressive disorder, somebody that's bipolar, et cetera, et cetera. Situational depression or sadness is very, very different from clinical depression. And as the doctor said, sometimes has a biological origin.
Anyone else want to add anything about some of the myths that as Black
Well,
men need to struggle with?
I think what Brother Marshall just mentioned in terms of the the idea that it only happens to women. So it speaks to the myth that indeed, in order to be depressed, you have to be weak. That it's a weakness, and that indeed, as we John Henry Black men, or at least those of us who have this John Henryism, don't want to necessarily cop to the fact that we can sometimes be sad or. And there's your point is also well taken that it's not just a sadness that just is specific to a day, but it's more pervasive sadness. And as we'll talk later on in terms of all the things that we as Black men have had to contend with, it's sort of hard to imagine just a one-day sadness when you think about these factors that have been happening in our communities for certainly centuries. So it certainly isn't a mark of I'm sorry, not a mark of weakness, and sometimes it can actually be a mark of strength. Having the strength enough to be able to reach out for help and be able to point out that indeed you're not just okay.
And I would like to just add also too that in addition to weak, I've also have heard a lot of men think, or the myth about it being it's for someone who's uneducated. It's for quote unquote crazy people, or it's for other races of people. So those are some of the myths that I've also encountered in my day-to-day dealings with depression.
And would you also say like men will push it down and try not to give that name depression? Like I'm just, I'm going through something, like anybody else is going through something. And it kind of goes on and on off of go for years. But it's that same belief system. It's not depression. I'm just going to push it down. Is that something we should be aware of?
I would say yes. Yes. I think that actually to continue to do that, I think is dangerous for us, because as we'll talk later on, if we don't acknowledge depression and what it can do, and we don't get the right type of treatment, it can cause a lot of other negative things for us in our community. So I think, it's something that we have to stop at this point.
And maybe get away from the lie that we often tell when a brother asks us, "Yo, how you doing?" "I'm good."
Right.
I mean,
exactly.
You might not have, given all the things that's happening at home and out in the streets, but I'm good. Yeah. And sort of kind of brushing it under the rug, if you will. And therefore no one knows. And because you're good, I'm going to be good as well. And then it doesn't necessarily allow brothers to help brothers, if you will.
And I was engaged in a conversation with a medical doctor 2 or 3 years ago, and we were in a space where we were talking about African American men, and he said that he was treating a 19-year-old African American male with colon cancer. 19-year-old African American male with colon cancer. So the cumulative effects of staying in depression for years manifests itself in diabetes,
yes,
all kind of cancers, all of the illnesses that we see that are prominent in African American men. A lot of that comes from that accumulated trauma that's not being dealt with.
This next question, I'm probably going to add a little bit more to it because of the time. So the question is, do you believe that the pandemic and racial climate has a correlation with depression? How do you see it playing out? So I want to talk about that because we just had Buffalo. And so my family is there. And so I know that Tops. My son used to work at that Tops. And we also talk about just, the killing of Black men by police officer. And we talk about the pandemic. And I want to add about vicarious trauma, because I know I've had an experience of just being so exposed to all these racial and SES and this political attack on Black men and just the Black community in itself. Can you talk more about how this all correlates.
Well, I guess I'm thinking about it as an old guy who's been sort of out here for a long time. I'm thinking, as you read from my bio, I've been sort of having to deal with the sort of the systemic effects of racism, going back into the 60s, and I'm not sure anyone else would kind of relate to this, but we thought that somehow we were making some progress in the sense that, indeed, that with we thought maybe through at least by the 70s, 80s, and even into the election of Barack Obama, that somehow this sort of racism thing would turn around. So as you talk about, then we get this incident in Buffalo, and I don't know that Buffalo's ever had that kind of racially motivated violence in the past. I have a nephew who talked about his brother-in-law being hiding in the basement of that Tops because he was there at the time of the shooting. And the sort of, you talk about vicarious trauma. I mean, they also have a little bit of survivor's guilt, and the whole idea of even hiding, from a gun shooter when other 86-year-old women may have been shot, where it could also cause that to happen. And as well as those who weren't there, and sort of realize that they indeed were sort of lucky, maybe because they just didn't get there, but all those who did die may have been close to them or people who they knew. And of course, that's only one example. All the whether it be George Floyd or all of the other gunshot incidents. But I also talk about it from the gentlemen that I work with who may have been shot by other Black men, but they also realize that part of that has to do with that systemic racism that put them in that sort of mentality that sort of fuels this kind of competition among Black males. And we sort of acted out against each other, even though if we talk, and hopefully we'll get to this later on, when you talk to these individuals, even if they were from rival gangs, they have a certain love for each other as Black men. So it's not a whole idea of Black hate, but it's an idea of sort of kind of fueling that sort of competition. And of course, I would probably say that the pandemic has only made it worse because it sort of made it fuel this whole sense of hopelessness and helplessness, and somehow there's little that we can do to sort of turn things around. And indeed, the number of Blacks affected by COVID was disproportionate. So again, it's sort of that sort of unfair victimization, unjust victimization sort of plays itself out. And of course, the increased isolation caused by COVID among African Americans who are usually community-based and have this need for communal connections probably had an adverse effect on our community as well.
Great.
And when you think about the isolation that was brought on by COVID, so at the beginning, when we were totally shut down, think about it. If you are in DC and you have your mother's in another, like you're saying, brother, your family's in Buffalo, we may have my family's in Chicago. Think about those yearly planned trips that you would take. I want to go see my parents for Easter, for Christmas, for Thanksgiving. We couldn't do that. We couldn't even go to church for Easter. And so that level of isolation is just not normal to particularly African-American people. So I think COVID brought on a level of isolation that intensified depression and collective trauma. Absolutely.
And the point I wanted to make is to echo that I think the two biggest, to me, symptoms of depression that I think the pandemic and the racial climate is basically taking a hold is hopelessness and helplessness, like the brother said earlier. I think the more we see these type of events happen to us, the more people get off from committing these type of crimes, or there's not equal, appropriate justice. With the isolation that the brother just mentioned from COVID, I think it just pretty much compounds the hopelessness and helplessness that we feel, which then exacerbates a lot of other symptoms of depression. So hopelessness and helplessness, to me, is the biggest symptoms I think we have to be careful about with the racial climate in the pandemic.
Thank you. are there different types of depression, and how does it show in men? And I think you touched on a little bit earlier. Where is there like a various levels of depression?
I would say, yes, go ahead.
Go ahead, doctor. Go ahead. Go ahead, doctor.
Go ahead.
I'm not sure who's going. Well, I'll start since I had a thought in my head. Yeah, we have this manual called a Diagnostic Statistical Manual that we use to form diagnoses, and it has a number of depression type disorders, and again, I'm not really big on sort of promoting that book because it's sort of is probably more for monetary benefits of the American Psychiatric Association, but it probably is less important what the diagnosis is. Dr. Logan said earlier, there's bipolar and there's major depression. There's some single episode, recurrent episodes. Some of them are just in reaction to a particular stressor that maybe maybe prolonged or short. But I think less important than a diagnosis is being able to get the treatment in whatever form. I just think it's more important to sort of be able to alleviate the symptoms and promote healing than being able to put a label on someone, which of course complicates their lives in more ways than it really helps.
Dr. Logan, you wanted to add something?
No. I think I agree with everything that was just said.
Okay. As it relates to our fraternity, it's made up of young college men all the way to our seasoned brothers. Does depression look different among these different populations from early adulthood to late adulthood? Mr. Marshall, you want to start with that?
Yeah, that's a very, very, very good question. And from my experience, depression is different. In younger men, what I've seen is depression is more situational than reactionary. Generally, they're responding to a loss of a relationship, some kind of loss of a loved one, loss of a job even, loss of a pet. In older men, what I've found is that the depression is more existential. It's like, okay, now when I get older, I'm looking at my legacy, I'm looking at my contributions, I'm looking at my children and what they've accomplished, and I'm kind of basing how I feel about myself on those kind of existential things. And so I think it is really different, particularly as you look at, 20-year-olds, 30-year-olds, and then you look at a 60 or 70-year-old.
And especially with our younger brothers who are undergraduate, in just the prime of the years, what would you say to them about understanding if they're going through a depression? What would that look like for them, and what are some things they can do to address it? Dr. Logan?
Well, one of the things that I think is good is that nowadays we are starting to get the traction with mental health that we need to. We're having conversations like these that's happening a little bit more often. So for the younger generation, it's not as taboo anymore as it once was for our older generation. Still is, still work to be done, but this conversation is happening a little bit more. So I state that because I think that with a younger generation, they're more willing to, they've heard of the term depression. They are a little bit more willing to say something to someone about feeling a certain way. And I would say that's what I would encourage them to do, is to continue to have that conversation with a trusted person about just not feeling the best. And I think once they say that to the right person or persons, that will be a springboard to, getting them in with a mental health professional or someone that they trust, that they can talk a little bit more about these symptoms of potential of depression.
I want to piggyback on that about getting to the right person, and on two folds. One is about communication. We talk about men don't like to actually kind of tell how they feel, so therefore that's the poor communication part. But when you say seeking out a mental professional, because it has that stigma of like, I'm not crazy. I don't need to see a therapist. Men are more likely to even talk to their physician before, if they go, because another barrier I get through is getting to the physician. Some may even talk to the minister. So when you talk about getting to the right person, what does that look like? Dr. Gordon, you want to take that?
Well, without blowing our own horns, I think it's good that we still have enough of Black men out there who are, who can identify with those individuals. I like the fact that we have, Association of Black social workers, Association of Black psychologists, and even Black psychiatrists of America that individuals can reach out to. We've done a pretty good job, at least forcing, the referral sources to be able to identify us, whether it be with a picture, otherwise, by our race. So that, because at one point they would have probably not wanted that particular racial distinction. So it made it harder for a Black man or Black people in general to seek a black therapist. I would probably imagine the same thing for Dr. Logan and Mr. Marshall, that individuals seek us out because of our race, and sort of trying to find someone who can relate to them and will treat them from a culturally sound and relevant perspective. So I think reaching out through those particular associations, but also realizing, and maybe we need to get that information out more, that indeed you can actually ask for a Black therapist.
And I like that you use the word Black therapist, because as we know in this field, Black male therapists is a shortage. In my practice, we have wait lists all the time. I have wait lists all the time. I have people waiting for me for a year, but because they want a Black male, and just not many Black male therapists. So what can we share with our community here about getting a therapist? Does it have to be a Black male? Does a Black male only have to speak to a Black male? Is it okay to talk to a Black female? Is it okay to talk to a white female or somebody else of color? How would they kind of go about figuring out what's going to work with them versus just saying, I can only see a Black male? Who'd like to take that question?
I can start up. Go ahead, Doctor.
No, sir. Please, no. I defer to you, sir. Please.
Yes. So the first thing, when folk seek out services, as Dr. Gordon said, they're looking for a level of comfort and safety. And so from the standpoint of the service provider, you need to try at all costs to provide that. And I find with African-American men, particularly, the language you use to make yourself available. I was listening to, or I'm just reviewing some of the titles of programs to provide services to African-American men. And when you start using the words treatment, therapy, I even seen one group, they were recruiting men and they said, okay, this is a soft skills group. So, you may not be able to get as many brothers in when you use that kind of language. So, understanding the language to use, understanding what some of the common needs of African-American men are, and then just using motif. Like if you're in your office and you use stuff that you have on your walls, show pictures of African-American men in help-seeking positions. And I think just those little kinds of things really do help. And then the other piece is having a level of skill, because I've found, even across the country, that we really do have a dearth of very skilled African-American men who can really provide a deeper dive into treatment.
Okay. Dr. Logan, do you want to add it to that?
So I think, to answer your earlier question, I do think that other people, in addition to African-American men, can help African-American men. I do believe that. I think that, the biggest thing that an African-American male needs to do, if they're considering to get assistance in this way, is to vet the person that they are considering. You have that right. A lot of times I think people don't believe that they have the right to vet, their mental health professional. And vetting that person means, asking questions about their treatment modality, going in to meet with them and seeing if you really have a connection. That person is someone you feel comfortable enough to open up and do this type of work with. And like the brother, just said, I think a lot of times it's about skill for the mental health therapist, and it's about goodness of fit. Is there a connection between you and your mental health therapist? But I caution brothers to vet their mental health professional. That being said, I still think that no one's going to take care of us the way we take care of each other. And that being said, because even with the skill that we have, there's a level of familiarity, right? There's those nuances that happen in our lives in America that someone may not know. That if you and I are sitting across from one another, me as the mental health professional and you as a brother who's coming to, kind of process some things, we can have a deeper, I think, richer, fruitful conversation because of some of those familiarities that others may not share. And so I think that being said, I still feel like there's a way that we can treat each other better than other people can.
Which, of course, means that our Black women can also treat each other with that same, because they have the same skills. Of course, they've been taking care of Black men for millennia. So, certainly going back to the original question, yes, a Black female therapist would also will have that same kind of cultural sensitivity, particularly if she's has that still has that connection to her community.
Shay.
Thank you for that. Now, we all about a certain age, we've been in this field for a long time. When we did our training, it was white males were the highest amongst suicide, right? Older white males, times has shifted. Like it really a shift. I just did a presentation for God Right, and we're seeing this increase of our adolescents with depression. So why do you think that we're seeing an increased depression and suicidality with people of color? And I want you also to take consideration microaggressions as being part of that. I'm going to go ahead and start with you, Dr. Gordon.
And I wonder about this kind of paradox that, as we have sort of quote unquote made it, or at least on the surface, it sort of has made us, a lot of us sort of think that somehow we should have more than we had back in the 60s. In those days, to kind of quote line from Porgy and Bess, I have plenty of nothing and nothing's plenty for me. The expectations weren't as high, and we didn't, at least at that time, we were able to sort of take care of our own inner community. It was okay staying in the Harlems and the South Side of Chicago and those areas, and sort of being able to have that community of folks. Yeah, there may have been some competition, but it wasn't the type of it wasn't with that alienation that has happened as we sort of moved up this sort of socioeconomic ladder, and then reached this sort of a ceiling. And so it's sort of paradoxical that this is kind of, because we've been fighting for more and maybe not getting as much as we thought we'd get, and still running into, obstacles. And as Brother Marshall said before, get to that point where this existential crisis where, okay, I've done all this, what do I have to show for it? What am I going to leave behind? I still have to worry about my grandson going out there and being shot because driving while Black, or my Black daughter not being able to be treated fairly at work because she decides to wear her hair in a natural, and all of those sort of things I think have probably contributed to the depression. I don't know that we're working any harder, but sometimes seems that way. Certainly seems like we're working longer hours and not having as much time for that sort of communal sort of resource sharing where we sort of filled each other up. So I wonder whether that's also fueling it as well. Increased sense of dissatisfaction, unfulfilled wishes.
Dr. Logan, you want to add, and could you also talk about what are some of the signs and symptoms that we should be looking for about suicide?
Okay. I agree with the brother about just the messages that we receive from society on a daily basis, and I think those messages, consciously and unconsciously, to me, leads to a lot of the feelings of, as we said earlier, hopelessness and helplessness. And as a result, again, when you look at the event that just occurred in Buffalo, and how often these type of things seem to happen in our communities, I think that definitely, at some point will play on someone to say, well, what's the point? Right? What's the point? I think just the demands of being Black in America, again, racism, poverty, complex trauma, underpaid, overworked, all of those things, I think, it builds up in a person, right? And at a certain point, you have the hopelessness and helplessness. And I also think being underdiagnosed as well as misdiagnosed, a lot of times leads to, the increase in depression and suicidality. So sorry, I kind of went off a little bit on that one, but what was the other point? Question
No,
about
actually, that was a good point because you and I have worked with adolescents and Black adolescents, and when you ask them where you see yourself in 5 years, they look at you like you're crazy.
Yes, they do.
I'm not going to be here in 5 years, and so it's almost they're telling themselves they're not going to be here in 5 years. Either that is through they think they'll be killed on the streets, or that they may also take their own lives. And seeing that is hard for our community. So the other part of that question was, what are some of the signs and symptoms we should be familiar with as we look at ourselves, as we look at our sons, our daughters, our nephews about suicide? What are some things we should be looking for?
Well, if I could chime in with the first part of the question,
okay. I
really do feel that depression and suicide amongst African American men has been an issue. I think that we're more willing to label it as such now. I think we're more willing to talk about it now. And one of the reasons why I think it is just real simple. I think that when you look at my generation, I'm 62 years old. It was really, really, really unheard of that you would hear men discussing vulnerability of any type, particularly depression. And so I think that the younger generations behind us have looked at us and watched us implode and explode. And they're saying it doesn't work. Not talking about this stuff does not work. And it winds up spilling over into family life. It winds up spilling over into work life. You're losing jobs. You become an alcoholic or drug abusers simply because you're not addressing the issues you need to address. Warning signs. When you see brothers withdrawing from things that bring them pleasure or recreational activities that they normally do, when you see brothers have a sense of lethargy, they just, they're slow moving, pessimistic or whatever. When you see poor concentration and irritability and sleeping a lot, those are some of the things that you see, I think, in African-American men that would tell you that, look, there's some problems going on here that really do need to be addressed.
Brother Marshall's point, there's two things that always resonate with me, and I think we can all do this sort of a kind of gut check. When you start feeling that you have that nothing provides you pleasure, and you have nothing to look forward to, when those sort of thoughts start coming into your head, and if you hear it or see it, because sometimes a person may not say it, but you can kind of get a sense that they're losing that sense of pleasure and certain sense of hopefulness. That's a sign. That's a sign that they are at least at high risk for suicide.
And I want to touch on what Brother Marshall talked about earlier, about alcohol use and marijuana use. So we know DC right now, marijuana is legalizing across the country. I just met with my 17-year-old client who smoked weed. His parents know about it. His anxiety. How does marijuana and alcohol impact depression, and does it help at all? Dr. Logan, you want to start with that?
Yeah, that's a very good question. I mean, I think I'll start with the alcohol first. I think that's a little bit easier from my experience and with the research that I've done. No, it does not help with depression. As a matter of fact, I would believe that it exacerbates depressive symptoms because alcohol in and of itself is a depressant. So someone who already may have some symptoms of depression, I think that may be the tipping scale for them, but it definitely doesn't do anything to help someone who is depressed. With marijuana, that's a double-edged sword for me, right? I've worked with a lot of people who do smoke marijuana and have often stated that, they either have depression or bipolar or some type of mood disorder, and they often state that how marijuana levels them out. So I do know that, marijuana may have some of those properties, but for me, I'm always nervous about advocating for that because I think that's a slippery slope and that can open up Pandora's box for other issues. So I'm still a little bit on the fence about marijuana use as it relates to depression because of those things. So that's pretty much what my experience has showed me thus far.
Then when you add the fact that you talk about Black youth smoking marijuana, this whole cycle where they become dependent on marijuana. I mean, not that I'm advocating alcohol, but most of us who drink hopefully don't drink to cure depression, but we tend, even those functional alcoholics knew to do it after they got off work. Too often our young people are smoking marijuana throughout the day. So it becomes abuse. It's not, if you need marijuana to sort of, get to go to work, it's still likely to end up losing that job. At least most jobs. There may be a few jobs where it's acceptable. So that's, as Dr. Logan says, it's a slippery slope. How do you contain the use? I always get concerned about using any substance to treat depression if indeed if it's going to impair your other functions.
And along with what Doc said, Dr. Logan, marijuana and alcohol are both central nervous system depressants. And when you have the presence of depression, in most case scenario, that slows down neural processing. So now you have a slowing down of the neural processing, and you have the slowing down of the central nervous system. And so most people, when they first start to ingest alcohol or marijuana, there is a sense of euphoria. But guess what? The C word, there's always a crash. And the crash makes the use of drugs and alcohol worse in a situation where the person is depressed and already experiencing biological, maybe even neurological impairment.
And we have to also admit that alcohol has some toxic effects on our organs, and we're already at risk for various chronic illnesses, including diabetes and high blood pressure. And obviously, alcohol breaks down to sugar. So, and too many of us know people in our family or in the neighborhood who lost feet and legs and amputations as a result of drinking alcohol and being able to go out and do things that put them at risk for gangrene in the toe because of a frostbite or other things. But we obviously know about cirrhosis of the liver and the other conditions that alcohol just exacerbates, and we're already at risk for those disorders. So another reason not to use alcohol as a treatment for depression.
I'm going to circle back when I talk about myths. Because one of the myths that we get is if I see a therapist, I got to get medication. Sometimes medication is something you may have temporarily. But are there any other alternatives to traditional treatment for depression? Who would like to take that question?
I'll certainly start. Yes, there is. However, I would start by saying there's no substitute for having the right combination of the right service provider that is responsive to the client's need, the right modality that fits the client's needs. We don't want to get caught up in finding a client to fit our approach. We need to find an approach to fit our clients. Having said that, I've used aromatherapy very successfully in treatment because it really does have that olfactory effect. And for men that are depressed, it kind of opens them up to other kinds of emotions in the moment. So I found that to be really, really, really effective, and other types of holistic approaches. I mean, I've been in a situation where I've, provided therapy for guys, and I said, look, just go home and nurture a plant. Let's buy a plant, and we're going to go home. We're going to take it home, and you're going to spend time nurturing that plant, or invest time in your children, something that really does distract them from the level of sadness and depression that they're feeling. So there's just really tons of different approaches that you can use inside of therapy and outside of therapy that are effective.
Yeah. I'm not sure how many of us have gotten away from traditional pet therapy. I say pet therapy only in quotes. I know when I was a kid, we had a dog, and dogs were good. And I think, and I'm not sure whether this is indeed the case, as we went up the sort of socioeconomic, particularly educational ladder, that we as Black men stopped having dogs. Maybe because we were too busy to come home and walk them and those sort of things. And so even the whole idea of going back to the plant therapy, if you will, in terms of taking care of a pet, having a dog can sometimes also be, or other pet might do the same thing. I certainly know with my young men, again, they are wheelchair bound. I've written a lot of emotional support letters for them because indeed having a dog, sometimes it's a pit bull, but still it gives them a purpose, something to look forward to, something to get up for in the morning. So, and as Brother Marshall said, there's a lot of holistic, strategies, but some of them are also basic. Being able to go out and play some basketball, getting some physical exercise, making that a part of your routine. Going to yoga studios, even those sort of things, and obviously socializing with the brothers at your fraternity is a strategy. There's also I know the Association of Black Psychologists, along with the Community Health Network, has been promoting this thing called healing circles. It's one is Sal Bono healing circles or emancipation circles. But also, I think that's also something that's many of our churches are offering as well. Those sort of healing environments where brothers can groups of Black males in the church can get together, a ministry, and be able to support each other, and maybe even do some positive things out in the community that can sort of help mitigate depression. And lastly, I've noted that some individuals have been able to provide barbers, if you will, with some training on sort of at least talking to their clients about mental health issues. And that's happened in hair salons too for women, but that may be another non-traditional way of being able to get to brothers who may have some issues and being able to talk about mental health in a sort of more welcoming and sort of destigmatizing environment.
And I'm glad you said that because, that's something I keep hearing more and more about, getting back to grassroots, because that's our community, right? As men, the barbershop, the women, the salon, and really starting to have those conversations where it's a safe space. So I appreciate you bringing that up. A question we have about therapy: when do we need it? Do we do it when we have an emergency? Do we really need to go before then? What are your thoughts? And I'll start with Mr. Marshall.
When a brother sees himself in a situation where his activities of daily living has been interfered with, that's a time where you need to seek help. When you feel like your emotions and your behavior are beyond your control, that's when brothers need to seek help. Last but certainly not least, frequency, duration, and intensity. So when you see yourself feeling sad most of the time, most days, and all day, frequency, duration, and intensity is something that is really a good benchmark. If that's happening to you, then that tells you that this is beyond such a situational sadness and you need to reach out for help.
I appreciate
that. If I may add to something with that, what I would also suggest is I would hope that brothers begin to look at therapy more in a preventive state, much like, going to the gym and working out or exercising, or going to get a yearly physical. I feel like the things that we encounter every day in our lives, to all the things we talked about earlier this evening, it takes its toll. So I think a lot of times, a lot of the Black men that I work with in my practice, most times we're just having conversations about everyday living, and it's a tune-up for them. It's a way of just talking about what's going on in their daily lives as a Black man in America. So I would encourage a lot of the brothers to look at therapy as a preventative thing versus, well, let me go once an emergency or a crisis has happened, because usually at that time, it's not too late, but there's things that have manifested that we could have cut off if we had been more preventative with it.
Awesome point.
So, Brother Logan, Dr. Logan, you kind of hit that spot again about a myth, because people think therapy is like TV therapy, right? You got this psychiatrist, a therapist, you come lay on the couch, and they kind of do this deep analysis, and that's not what we do, right?
No.
Especially when we talk about work within our own community. We have to be able to speak to our own community in the way that they want to be spoken to. And like you said, those conversations. And that's kind of how I work as well is, what's going on for you, brother? Mm-hmm. What happened? What went well for you? What are some things you want? Like, it's a conversation. It's not even that. It's not that I want to sit here and dig through your head. You may just need a release. And then whatever you want to do with that, we'll do with it. So I think talking to Black men about therapy is not this TV land that we see, or we always think about it. It's a Freud kind of world, and I want to sleep with my mama. That's not what we do. And I think that's a big myth that we need to address here to let them know that therapy is really about focusing on what your needs are. It's that time for you.
I know Brother Marshall talked about, if you're feeling sad, I would also add the fact that if you're angry all the time, because again, sometimes it's not really, you may not identify it sadness, but you're pissed off at everybody all the time, as you talked about the frequency, duration, and intensity. Yeah. That's another time to be able to go out there and seek a therapist. And as Brother Bishop said, we're going to not only, sit and talk to you and find out, what's going on. We're going to work collaboratively with you to try to solve that problem. Yeah. How do you want to work on it? So it's not a situation where you're just out there spilling your guts, or this person is sort of just passing judgment on whether what you did is right or did was wrong, but be able to come up with collaborative way to solve issues, and hopefully over time to heal pains that you may have experienced because of, somebody mentioned about loss earlier. And obviously, loss is something that we're all vulnerable to, and the longer we live, the more we have to endure. And of course, trauma is another thing that we all are vulnerable to and have, suffered not only in our generations. We talk about post-traumatic slave syndrome, over the generations. Every time I still haven't watched, some of the more recent, Black slave movies because I'm still recovering from Roots. Yeah. And so, but just to know that those things are still happening is also important for us to kind of be able to unpack and try to heal from.
I noticed that we're getting some comments in the chat, which I'm happy about. So I'm going to ask this last question and I'm going to move to some of the brothers' questions in the chat. How do we as Black men create a work-life balance, and what are some tips to reduce stress? And I'll start with Dr. Logan.
I think I'll piggyback on what's already been stated. Going back to grassroots, going back, keeping it simple. Exercise, spending time with your family, getting a pet. I love that idea. I love the gardening idea. These things are things that can just allow you to get into your world, your zen, and just allow you to kind of, pause for a second. So, I would definitely suggest we just get back to that. So that's where I'll stop it. I think just getting back to some of the grassroots basic things of just relaxing and taking our moments.
Mr. Marshall?
Brothers, you've got to get some rest. You got to know when to turn it off. You gotta know that drinking water and eating right is going to help you feel better. Brothers, you have to be accountable to somebody. Get you a mentor, somebody that you can that can embrace you in those times of need. Now, we talk about crisis plans as it relates to our consumers. Every man needs a crisis plan or a trouble plan. That when I get in trouble, psychologically, not legally, but psychologically, emotionally, socially, spiritually, who am I going to call onto? What places and spaces do I need to be in to ensure that I maintain or at least go back to a state of balance?
Excellent point.
Dr. Gordon?
Well, I think so much has been said. Putting clear boundaries, I try to practice what I'm going to preach in how many hours you work and making sure that the hours that you work don't spill over into that family leisure time that Brother Marshall talked about. Making sure that you can put those firm limits and be able to say no to requests for your assistance. And again, as Black males therapists, we probably have a hard time doing that because there's such a need, but we still need to be able to take care of ourselves so we can take care of others down the line. But so I would probably echo all that's said and sort of just reinforce the idea of being able to set clear boundaries on when you'll take phone calls, answer emails, and all of those other things that pertain to work, and allow that time for yourself and your family. Schedule some time with your brothers as well. As you said, Brother Marshall, knowing who you can call. Man, it's been a tough day. Or watch a basketball game, even if it's long distance. In other words, you may not be in the same room with the person, but y'all can still be commenting on that football game or that basketball game.
Great suggestions. So go to the chat. The first question I have: how do family members help to channel loved ones to seek mental health counseling and psychiatric intervention, given the historical social stigmas attached to the mental health challenges and seeking counseling? Who want to handle that one?
Obviously, you're going to tell them how much you love them and that their mental health is just as important as their physical health. And if indeed, be able to be willing to even accompany them, if that would sort of increase their willingness to at least for that first session, to let them know that did we lose Brother Bishop?
I'm still here.
Okay. So that at least is one way to sort of help them sort of at least be willing to tell them that this is not a negative stigma, that you really love them and you do care about their overall health?
I am because we are, and because we are, therefore I am. We have to understand that nothing we do only affects us. And so when we are sad, when we are not at our best, our family members, our beloveds really are negatively impacted by that. So I think if anything a family member could do is to help the depressed brother or the brother that's in need of care, then look, your pain is my pain.
Mm-hmm.
Your struggle is my struggle. So let's do this together. Let's engage in help together.
This next question is interesting. Are there any healthy aspects to degrees of depression?
Say that again.
Are there any healthy aspects to degrees of depression?
Wow.
One healthy aspect, and you said to degrees of depression.
Yes, degrees of depression.
I would probably, it certainly is maybe a healthy aspect if you grieve someone who's passed on, right? I mean, having that grief depression is probably a healthy kind of sort of allows you to sort of acknowledge that a part of you is gone, and be able to at least acknowledge that would at least allow you to then sort of find healthy ways to sort of grieve that person who's passed on or any other particular loss. The challenge is how to make sure that healthy aspect, if it doesn't become unhealthy, as the quote of Brother Chester Marshall, doesn't become that intensity, duration, and frequency.
And that's a supreme question. Because I truly believe, and this is non-conventional, that all feelings are tracers to the essence of who we really are. So when a person is feeling fear, when a person is feeling sad or depression, it is your body's way of telling you to pay attention. Now, we know that there are deeper forms of depression that goes beyond that. When we talk about bipolar depression and major depressive disorder. But when a person is feeling a certain kind of way, it is your body's way of telling you to pay attention. And to what is the work? The work is to discover, why am I feeling the way I'm feeling? Do I need to pay closer attention to my relationships? Do I need to pay closer attention to my family, my job, et cetera, et cetera, et cetera? We're all balancing the opposing forces in our life. And I think sometimes even depression can lead us to where we need to invest more energy and time.
Just give me a second. The person who asked the question was sending me a message. I want to make sure I get their question the way they want. Okay, I'll come back to it. The next question, more about coping. Please advise with 3 to 4 key measures for our young men armor to help manage their chronic traumatic stress issues as it pertains to Black men and women managing life when faced with daily abuse of micro and macroaggression of whiteness.
So is the question asking for coping mechanisms?
Yep, they're asking 3 or 4 measures we can kind of give our young men to kind of shield them, put them ready for to go out into the world.
Okay.
First off, I believe that morally correct and emotionally balanced men are not born. They are formed and nurtured. And so each male, man, boy needs a protective environment early on in his life where he can be nurtured to the point of mental wellness. And rites of passage programs have been used to do that, and there are other programs. And what that intentional grounding does, it leads you to always keeping a healing circle in your life. I think Dr. Gordon or Dr. Logan mentioned that early, that we, even when we're nurtured to be mentally well, we have to maintain throughout our lives a healing circle that we can turn to in the face of adversity.
And with that said, I think it's important to be able to let those young men know that indeed that what they're feeling is valid, and open up dialogue. If they face something out there in the streets, at their job, at school, come home and tell it.
Yes.
Not that we're going to necessarily go and fix it on the spot, but be able to express those emotions so that we can then at least validate it. If we need to put our arms around you and kind of and give you some tips on how to handle it.
Jay.
Yeah, I would agree. I think that we have to continue to change the narrative. So to the same point, we letting them know that to be vulnerable in appropriate spaces is a good thing. It's okay to feel, it's okay to talk about feelings, to communicate with them, as well as that connectivity. They need to see examples. So to what Brother Marshall just said, they need to see examples as to what they can be and where they need to go in the blueprint. So if we have that connectivity, if we maintain open lines of communication, if we let them know it's okay to feel and be vulnerable, I think these are the things that can help them deal with what they're going to face.
And even though it was maybe a woman's movie, I think all of us should be able to exhale. Yeah. So being able that whole idea of waiting to exhale, don't wait to exhale, brothers. Being able to let them know some of these breathing techniques that are so simple that have been promulgated have been in our communities for a long time. So make sure that they do, whether it be with aromatherapy or not, be able to breathe and be able to let some of that stress out.
Yeah. Would you guys also say connecting? I want to say the word spirituality. If religion works for people, religion should be it. But sometimes people just need the spirituality, connecting with, the environment. For me, ancestors, God. All of those things are another coping mechanism that I think supports our young people. I think we get lost in that. Young people think, it's all about me, and they forget that it's about our community. And that's, that collective ideal versus that Eurocentric individualistic. It's about me. If we surround as a village, they get to learn it's about us. And that's another way to arm them to deal and cope with what's going on in the world.
And actually, Brother Bishop, Dr. Bishop, when you mentioned earlier about one of the factors that may be fueling more depression and suicide, may be the fact that we aren't much a part of an organized religion as we had been in the past.
Thank you. Another question. There's a push in certain circles for psychedelics such as mushrooms for treatment for mental health challenges. What is the current dogma regarding this? So the question is this a bona fide way to manage mental health using psychedelics?
Well, I know, and I happen to know there was a conference that I'm attending this week where they were talking about psychedelics for PTSD treatment. But that has to be under strict controls, and those findings are still coming out. But I have yet to hear anyone talk about it as a treatment for at least routine depression. So, I'll open up to others who may have heard otherwise, but I have not thought about those psychedelics as treatment for depression. Some people have started talking about others like esketamine for treatment-resistant depression, but even that, the jury is still out.
Got to be real careful with any type of mood-altering substance, even the psychotropic drugs that are have been certified to treat depression and other mental imbalances. My personal approach is to stay away from it altogether. because I personally have not seen any research or any knowledge that would tell us the efficacy. I'm talking about the full efficacy of any type of drug and treatment. There's studies, there's editorial articles, but none that I've seen really give us a full picture and a full idea about just how effective these drugs are, or these substances are.
And I would like to echo both of the brothers and say that I am not comfortable with myself or any of our brothers going to a sunken place. So therefore, what I would suggest is to run away from something like that at this point, because like the brother just said, there's not much efficacy out there about that at this point. And I'm just really scared that someone would try to do something to us that we don't want to happen. So no, I don't support that whatsoever at this point.
Another question. They're glad that we're talking about young people, but they want to know, can we speak to strategies that older individuals between the ages of 50 and 70 and mental concerns? What kind of strategies can we give to them for that age group to address mental concerns?
Connecting them to activities that will allow them to share their wisdom. I think what in the African-American community particularly, we had the griots, we had the older people, the elders, that would always impart wisdom. That was their role, to impart wisdom. And I think that in and of itself, when a brother between the age of 50 and 70 sees that they're useful still, that really does a lot to help their mental health. I think you have to do legacy work with 50 to 70-year-olds. You have to get them to have a balanced view of the things that they may have regretted or feel sorry for, and the things that they're going to leave behind. Because certainly at that age, people think more about their mortality, and so we have to do work around sense of mortality and sense of legacy.
Well said. Anyone else want to comment on that? Okay. I got a question. This is for all of you. Have either of the panelists had any experience with or utilized bottom-up therapy to activate the parasympathetic nervous system and calm down the sympathetic nervous system? Anybody familiar with this bottom-up therapy?
Well,
brother, I don't even know what that is, brother.
Okay, I didn't know either.
I imagine Dr. Logan would also know from his EMDR stuff. It's breathing is a bottom up. It has to do with sort of doing things that sort of help the system relax, like the parasympathetic nervous system, which is the part of it's kind of like the brake on your to the accelerator. We all know about fight or flight.
Yes.
So the bottom, so it's the bottom up. The bottom up is about breathing and other sort of sensory things that sort of help calm the system down. And certainly, I use it, and I imagine Brother Marshall has used it, even though he doesn't know it, because when he's burning them, aromatherapy is a bottom up, because it sort of helps calm the system.
Absolutely.
Meditation,
Okay.
all those.
So they said the bingo, EMDR is a perfect example of bottom up. So that's what we're talking about.
Yeah.
Gentlemen, I really appreciate you being here with us today. I think this conversation is a continuous conversation, especially Black men talking to Black men, really getting to those questions that we can't ask outside this circle. I really appreciate this conversation. I do groups in the jail. And so I have all Black men, and they do excellent work kind of just having these type of conversations and really just pushing themselves forward and doing better for themselves to be ready to come back in the community. The next part of this program is that we're going to get giveaways. Brother Eastern Province Tech, if you could give the mic to Brother Orrin Howard, he's going to announce giveaways. So, as you register for this program, we randomly picked your ticket number, and we're going to give you some giveaways for this event. And I'm let Brother Howard announce that.
Can you guys
get the mic?
Can the brothers hear me?
Yes, we can.
Greetings, brothers. Greetings. And first of all, on behalf of Kappa Alpha Psi Fraternity Incorporated, I just want to thank this distinguished panel for coming out and really filling us with some things, some food for thought. It's always a privilege to see. And it's a very difficult thing to see 4 unicorns on the stage at the same time. So we appreciate that. For our winners, I'm gonna go through them. We're gonna need we'll email you to get some background information. Our first prize, one gallon motivational time water bottle. That's going to go to Brother Cleve Ewell. I think that's the name. We also have a 6-month membership to Audible. That's going to Brother Aaron Terrell. We also have a 1-year subscription to the Calm app. That's going to go to Brother Alex Baker. And then we're going to give a Fitbit Charge 4 to Brother Brandon Cyrus. And we're going to end up this time with giving a nice massage gun to Brother Stephen Hamlet. So those are our winners for this evening.
Thank you, Brother Howard. In closing, I want to just appreciate everyone being here for this conversation. I also want to recognize my subcommittee, Brother Howard, who's worked really hard, helped me develop this program. Brother Dexter Reed and Brother Kevin Jackson have been part of this subcommittee. I just want to give them a hand of applause as well of put this event together. I hope you enjoyed this program. Please complete the survey. I put the survey in the chat. It will be also posted on the Eastern Province website. We are looking to do more programming. We want to hear from you about what you want from the Health and Wellness Committee. We have future programs coming up. We're going to be doing colon cancer and prostate cancer and other more events in the future. But please fill the survey about this event so we can develop what you need in this province. And I'd like to thank you very much for being here tonight. Okay.
Good night, all.
Good night, everyone.